My name is Dr. Emmanuel Teviu. I'm the acting program manager for NACP, Ghana Health Service. I think that we work closely with our civil society organizations and implementing partners like Garnet to respond to the HIV epidemic. As we are aware, the general objective, which aligns with the global objective, is to end HIV by 2030. And as a program, we are supposed to lead in the response activities in Ghana in terms of the health aspect. And in doing this, we aim to reduce new infections by 80%. And then also HIV-related deaths by 80%. Now, to be able to achieve this impact, we need to also meet the fast-track targets of 95, 95, 95, which means that 95% of people who live with HIV should know their status. And then out of that, 95% should also be put on treatment. And I also expect that 95% will achieve a viral suppression. Now, we realize that as a country, the awareness creation and issues of stigma has gone down. It's not really as it used to be. And that is why Garnet is taking this initiative as part of the response strategy to see how we can galvanize various stakeholders using the power of social media, targeting media influencers, the youth, to be able to drive this agenda to make sure that we create more awareness on HIV/AIDS for the youth and then for the general population. This is very key because the risk factors are there and people need to know about these risk factors, so that they can know how to behave and live to prevent getting HIV. Let's look at it this way. It's like having a tap open and then you are busy mopping the water that is coming. The easy way to tackle the problem is to go and close the tap. So this is what we are looking forward to, that let's prevent, let's give out the messages, empower people, empower the population to take, various practical steps, change their behavior to prevent getting HIV, and then we'll be on our way to tackling the epidemic. So it's a very useful workshop, and the program is partnering with Garnet to ensure that this workshop achieves its objectives and then develops the capacity of these young, very dynamic social change agents to be able to create awareness using their platforms on HIV, so that together, collectively and collaboratively, we'll respond effectively to controlling this pandemic to achieve our objectives by 2030. I think that is an opportunity they have, which they should take advantage of. They have a role to play as social change agents, and they should take the workshop seriously. They should, listen to the facilitation very well. They should ask all the relevant questions to understand the HIV epidemic very well, so that when they do that, they can be able to give out very useful, effective, and factual information on the HIV awareness creation and prevention measures. And I think that together we can achieve our objectives. So the 1990 target was up to 2000. 2020, But then as we reached 2020, we had to set new targets. And we thought globally, if you look at the response, I think that we had done a lot. And so that is why we gave ourselves another ambitious target of 95, 95, 95 to push ourselves more, towards doing more. So I think that we are poised to do that, and we will continue to depend on everybody, all stakeholders, to support so that we can achieve this objective. I mean, we still have a lot to do, I must admit. We have a lot to do, and I'm sure that we still have about 5 years to go. And I'm sure if we redouble our efforts, it's doable. It's doable. We just need to redouble our efforts. So I'm sure that that's why we are getting everybody on board, including the media, including people who really can support. So if we redouble our efforts, it's not a target that is not outside our reach, but we really need to redouble our efforts, and we need support of everybody to do that. So we know the stigma is a very big social problem. In fact, it's a hindrance to the response strategy as a whole. And we need to understand that we've come a long way. Looking at the first cases we had in 1986 up to now you would rarely see people who have the classical AIDS disease, where you see them in the hospital very slim, weak. You don't see that. That is because of the power of ART, the treatment. And we know that if we are able to put people on ART and they are very compliant, they will get to a point where the viral level in their bodies will be so low, which we call U equals to U. Undetectable means untransmissible. So we need to know that there is solution. We have the medication is there, it's very effective, it's safe. So it's better to know your status and be on the medication and live your normal life, and then you reach a point where you may not even be able to transmit the virus. That is what we are looking forward to. We know stigma is a problem, but now we have a solution. There's medication available, effective, safe. So we want to encourage everybody. And also, we should now begin to think of HIV as malaria, as hypertension, as diabetes, because it's a chronic disease now. If you get HIV, it's just like somebody who has gotten hypertension, who has gotten diabetes. You have to be on your medication. There's no difference at all. So that is how we should begin to think of HIV. And I'm sure that if we do that, we will be able to live and then, combat it. And then I'm sure stigma is rather killing people instead of the disease itself. We should reorient ourselves in that respect.